Hello, and thank you for listening to this webinar. I'm Rahul Bhardwaj, the President and CEO of the Institute of Corporate Directors. Whether due to personal or family health concerns or financial worries, the anxiety caused by COVID-19 is so widespread that I expect that almost everyone is impacted to some degree and in some way. Board directors are drinking from a fire hose right now, so it might be easy to forget about the people side of the business equation. But directors owe a duty to their employees, just like they do to their shareholders or other critical stakeholders. This sets up today's webinar conversation on the board's role in supporting mental health during the COVID-19 crisis. Joining me today are Mary Jo Haddad, the president of MJH and Associates, which provides strategic leadership and healthcare advisory services. Mary Jo is a director of the boards of TD Bank and TELUS and is a former president and CEO of Sick Kids Hospital in Toronto. Joining Mary Jo are Dr. Donna Ferguson, a clinical psychologist at CAMH who provides assessment and treatment in the area of post-traumatic stress disorder and other anxiety disorders. And Nigel Branker, the president of Health and Productivity Solutions at Morneau Shepell, where his team develops solutions that help health outcomes for employees with a view to increasing workplace productivity. Welcome to you all. Donna, I want to start with you. What are some of the triggers of stress and anxiety that you're seeing at CAMH? Fear of getting sick and loss of income are likely two of the major drivers, but are there others, and how is this starting to manifest itself?
Yes, definitely getting sick and loss of income are definitely prominent, and I'm seeing that quite a bit. But, I'm also hearing about and seeing people concerned about fear of dying, loved ones getting sick and dying. In terms of financial stress, people are worrying about job loss. They're worrying about paying their mortgage, their car payments, rent. It's quite distressing for people. Another thing that I noticed that we're seeing quite a bit of is because of the social distancing, which I know that, we have to do, people are somewhat isolated. They're not connecting as much. They're not able to see each other, and I think that's a major problem. And all of this is really leading to a very stressful situation for some people. When we think about how we treat depression and how we treat things like anxiety, we have people socially connecting, and that's often very important. But right now, when, we're in a position where we have to be socially distancing, it's making it challenging for people to do just that.
Right. So let's pick up on that social distancing a little bit by saying that another dominant feature of this crisis is enforced work from home, a form of social distancing. So let's talk a little bit about the impact of that. Technology mitigates some of the logistical challenges, but working from home can sometimes take a toll at the best of times, and these are clearly not the best of times. So what are some of the conversations you've been having about supporting workers who now find themselves suddenly dislocated? And I'd like to go to you, Mary Jo, first, then Nigel.
Important for leaders to stay connected with their teams at the best of times. So it's really important through this crisis that need is even stronger. So staying connected through online chats, regular scheduled meetings, daily check-ins is incredibly helpful to those employees working from home. I've talked to some leaders, great examples of creativity and trying to stay connected and keep some normalcy in terms of team dynamics. One CHRO, for example, has created a happy hour blog she writes every Friday. The message is encouraging, it's grateful to staff, it highlights some of the stories of kindness and compassion in the company. Really well received and a great indication of caring and compassionate leadership. Others maintain their weekly team social, so really fun to have their virtual social hour. Again, staying connected and helping to some normalcy, if you will, in the relationships at work.
Nigel, what are you seeing in terms of the dislocation and how some are remedying that?
Well, I would say, I'd start by saying, we probably take it for granted as senior leaders that we have the benefit to being close to decision-making and seeing how quickly organization priorities are evolving. So I do think it's important that we step up and help our leaders to focus and, in some cases, deprioritize activities. I know with some of our teams, there may be things that have been more long-term in nature, and that without direction, our people won't know any better. But to keep working on that. So I do think helping to prioritize goes a long way. Building on Mary Jo's comments, I also think there's this idea of the new normal in terms of productivity. I think we have to reduce some expectations. Now, granted, there is a spectrum where for some people that doesn't represent a significant change. If you're already working from home 2 to 3 days a week and you have a home office set up, this is not a big change. But if I think about some of our disability case managers, when we started our business continuity, where we actually had them take their desktops and move to working from home, I mean, they had never worked from home before. So in those cases, I think you have to stay close to your people. I think communicating is more important than ever, both the frequency and the modality. Certainly there was a situation with one of my teams where we did a video chat, and I just did a follow-up with someone because they sort of didn't see themselves, and you just wanted to check in and see, are you doing okay? Is there anything we can do to help? So I think I'd reinforce what Mary Jo said about being close to our teams, communicating regularly, recognizing there's a bit of a new normal, and helping our people to focus and prioritize.
Right. Now, just a quick follow-up to that. Is it possible to be over-communicating in this environment?
I can go first. I think it is possible, but I think you have to be very targeted with your communication. So certainly in terms of health and safety, as the situation is evolving and we're hearing more from the public health authorities, I think it's important to communicate that. In terms of more business continuity and communicating with your people, I think frequency is fine, but you have to maybe make them a bit more kind of punchy and directive. So what we're doing is shortening some of our touch points, deciding when you use email versus video chat. But I do think people want to hear from their leaders. It's just a matter of being respectful of time and prioritizing appropriately.
All right. Mary Jo, any thoughts on that?
Yes, I think I certainly heard from people they're overwhelmed with communication. We're getting a lot of information that's just in time. Things are changing, hour to hour, day to day. So I think thoughtfulness in terms of communication that's targeted, that's transparent and respectful, and maybe setting up a time of the day where people know they're going to hear from either their manager or their CEO. I think those things are really helpful.
Right. So let's move on a little bit to how boards and other senior leaders can help their employees navigate these mental health challenges. Is this a matter of rolling out mental wellness programs more broadly, or, in your opinion, does it require something else completely? And Nigel, I'll start with you.
Yeah, I would say even before the outset of a pandemic, I think the advice we would give to organizations is to meet people where they are and to help with the level of support that they need. I do think there's sometimes still a mindset of, one program, where in reality, if we use the pandemic with COVID-19 as an example, people need different levels of help. Someone might just need a video that they can look at to help them talk about COVID-19 with their kids, and that's perfectly fine. Someone might be a little more distressed and struggling more with anxiety and maybe want to talk to someone. Another person may need a more structured approach to therapy or cognitive behavioral therapy. Someone else may be struggling with substance abuse or with elder care. So I think there's a whole spectrum, and I do think there's sometimes a bit of a prevailing mindset of offering one program broadly across the population. So I would say, try to meet your people where they are and recognizing and be empathetic that different people need different levels of support. So that's one thing. I'd also say for organizations, we've started to see this in some work, that we really think of mental health support as more of a business issue versus an HR issue. And I think the business issue would be thinking about how much of an impact does this have on your workforce in terms of turnover, in terms of disability, in terms of lost time off, and what are you prepared to invest to tackle that? And then once you do have a sense of investment, I would say a lot of organizations still struggle with the idea of a smaller group of employees maybe requiring a comparable level of investment as a larger group, kind of back to my earlier example. So I do think the idea of having a thoughtful approach to the programs that you're rolling out, recognizing that different segments of your workforce need different levels of help, and really focusing your spend. There's some things that help everyone. I think training your managers to be empathetic and sympathetic are great. I think communicating whatever tools that are available so that people know that they're there is fantastic, but I would start from there.
Donna, it seems to me that Nigel is sort of saying that in some respects it's more than just about programs, that it's actually a bit of a culture shift in an organization. I wonder what you think about that.
I actually tend to agree, and Nigel touched on some very, very good points, a lot of which I was actually going to speak to. I think, first of all, we really do need to meet people where they're at. I agree with that. One size doesn't fit all, and we need to be creative about what people's needs are. I think connecting with staff, I think connecting, through video, FaceTime, phone, engaging and assessing the environment to see what people's needs are, I think is important. I do think there's a place for mental wellness programs and building those in and having something for people when and if they need it. Sometimes it's a staged approach where you start with just engaging people and then maybe providing some psychoeducation and then looking at more like coping strategies or tips, to the point where if people actually need clinical care, they're actually able to access that. I think having people and reminding people to check in with EAP is important as well, and the programs that already exist is also important. And again, the whole showing empathy and really being there for each other, I think is key with all of this.
And Donna, would you feel that highlighting that at a time like now, during COVID-19, is that going to heighten anxiety in an employee base and staff, or do you think that would in fact help mitigate some of that?
That's a good question. For some, it might heighten anxiety. I mean, we're all very different. But I think overall, it actually shows people that, you're stepping up, that there is support, and that if they need help, that they can get it. I think it's better than sort of standing back and waiting for people to come forward, because often people won't. So if you don't present those options and that support, then I think the majority of people who are really looking for it won't know to access it.
Mary Jo, I'd love to bring you into the conversation and get your thoughts around what we've been hearing around programs versus culture, or programs and culture.
I think it's so critically important to really learn from the moment that we're in, and if we really recognize that mental health is health, and if we've got corporate wellness programs, there needs to be a focus on this as part of the culture, and if we can build on something that we've already got in place and understand the needs of individuals. I think we've heard both from Nigel and Donna that we're all individuals and we all have different needs at different times under different stressors. So those programs, having baked into the culture of an organization and really tooling managers, leaders with how to bring them front and center when they are required within their own teams, as opposed to just having a corporate policy or a benefit that's available for someone to access if they are courageous enough to go at it. So there's a tremendous amount, I think, of opportunity here to leverage what's in place today to look to those who have great leadership and benefit programs that are being offered to employees on a routine basis. We're in a crisis, and in crisis, we need to be able to step up and share some of those learnings.
Mary Jo, do you still get the sense that people are hesitant to access EAP?
Absolutely, they are. I know that firsthand from both running programs myself, but also when you start looking at data points in the analysis corporate-wide, you can see that through crisis periods, people tend to access more frequently, and crisis periods could mean a downsizing, transformational change in an organization. So those are the times where it's really critically important that we're not just leaving access up to an individual to, go to the benefit website and look at who can I get access to, but it's tooling managers and leaders to encourage people to access what they need when they need it.
Right. Nigel, I know that's a large part of your business at Morneau Shepell. I'd love to get your thoughts on that.
I tend to agree, and I'm actually an actuary by background, so I tend to pivot a lot to data, and the data is pretty clear that depending on what study you look at, somewhere between 1 in 5 or 1 in 3 Canadians will have some experience with mental health that will impact their productivity. And if you look at typical EAP utilizations, it's probably more in the 6-8%. So it does say that there's a lot of people that would benefit from help that because of stigma are not reaching out for help. And where they then show up from a productivity perspective is either in turnover, that they would leave the workforce or leave that employer, through lack of engagement, and ultimately in the incidence and duration of disability. So I think the story does hang together. I would agree 100% that because of stigma and maybe lack of awareness of the tools and support available, less people are reaching out for help that would benefit from help.
All right, Donna, would that be your experience as well?
Absolutely. I don't see it from Nigel and Mary Jo's lens necessarily, but hearing about it even from clients coming in for assessment, hearing about it from friends, colleagues. I've been involved in helping to set up mental health programs for CAMH, and we struggle to see people accessing those programs. And so we know that it's not that people aren't experiencing mental health issues. What we see is that people, for whatever reason, are not accessing help as they should or they need to.
So let's talk a little bit about the mental health of a management team and of the CEO. And so on top of the anxieties around getting sick, there's serious challenges in trying to navigate their business in a time of COVID-19. That could be a lot of pressure. Are there particular issues to be conscious of when it comes to senior managers? Mary Jo, I'll go to you first.
CEOs and C-suite leaders, this may be their first crisis of this magnitude. That's so disruptive to every part of their business. It's important for us to remember, particularly as board members, that executives and CEOs are not immune from stress. They're there to support their staff, and they're supporting their employees. They're working 24/7 under extraordinary pressure, trying to maintain a business, taking care of their employees, diminishing revenues, loss of stock value. So, not to mention the fears and concerns they have for their own safety and their own family's health and safety. So I think clearly this is a critical time of staying connected as board, both chairs staying close to the CEO, as overall boards to take a pulse on how the organization's doing, how leaders are managing through this. Not unlike with employees, communication is really critically important. So, encouraging those regular board updates. Again, not trying to overload an already overloaded leadership team, but I know firsthand that great communication with board chairs, committee chairs, and the board overall is really supportive to a leadership team through a crisis period.
And Mary Jo, in your experience, do boards benefit from having that conversation amongst themselves, perhaps in an in-camera session, to say we're going into a unique situation that requires us perhaps to adjust our behavior a little bit, and we should acknowledge this and have a conversation on what those implications could be?
No, I think absolutely. Any type of coming together around a crisis for a board is really important to understand, what the company's going through, how leaders are leading, and also what boards need to be doing differently in terms of either their pulse check, their support, and or thinking beyond the crisis. The leadership team is in the moment and are trying to manage through and juggle a number of balls. So, when boards certainly can come together and start thinking about what's going to be required post the crisis, but also importantly, how do we support in a different way our current leaders who are managing through the crisis.
And Nigel, what are your thoughts about that when it comes to senior managers? Is there something unique about that circumstance?
Well, I would agree that the challenge of business reality, business continuity, security of the company future, coupled with fears for employee safety. I mean, we're trying to mitigate and manage loss of life, broadly across Canada and for our workforces. So I think this can really affect the mental health of senior leaders. And, senior leaders are wired, probably present company included, to think it's impossible to take breaks to recharge. And, I do think it's more imperative than ever that our senior leaders practice self-care and lead by example. I think acknowledging how distressing the situation can be. We run a press conference with the Premier of Manitoba last week, launching more mental health support for that province. And he has shared a personal story about his experience with mental health. And so I do think encouraging our senior leaders to take some time for themselves and really role modeling to their people, because people are looking to them for leadership, for trusted information, and an example.
Nigel, let me just build on that for a second. I think, you raise a really important point about senior leaders role modeling this type of behavior. Can you give an example of what that could look like? You just alluded to one of the premiers, but if you were to bring it into even, an ordinary corporation, are there examples of how senior managers can role model proper mental health or good mental health behavior in this environment?
Sure. Well, I'll give you one example with one of our teams, with some of my direct reports. I mean, for the next 3 weeks, we're putting in a program where I'm asking every senior leader to be off for 1 day a week and make sure we back each other up. If it's a critical emergency, we can reach out. But for the most part, I do want them to take that day a week, this week, next week, and the following week, just to be able to maintain their leadership at a sustainable level. So I think even just setting that example, that it's okay for your leaders to unplug. I'm sure for most of our teams, one of my teams was saying that, they've lost track of the days of the week. Right now, it's just waking hours and non-waking hours. So even something like that, where we can challenge and encourage our people to set some boundaries. I mean, that's an extreme example of a day a week, but it could also be setting boundaries for dinner, setting boundaries to not check email. I think those are practical examples that we can help our people with, and we can show up as senior leaders.
Right. And Donna, I want to come to you and build off this just for a moment. If you were to put yourself in the position of a director on a board, what sort of cues or clues would they be looking at to see if senior managers were really experiencing an unhealthy level of pressure?
Yeah, I think, seeing how they are interacting. I think if they're becoming more socially isolated, if they're not they're not engaging as much in conversation, I think things like depression and anxiety can take a toll and manifest in different ways. People withdraw often. They don't engage. They may be subtle things that they may not want to eat lunch. if people are eating lunch, their appetite's not there. They might even be looking tired or being worn or fatigued. Can manifest in different ways with different people. But I do think it's something to keep an eye on, and both Mary Jo and Nigel had some really good points about self-monitoring and monitoring the senior leadership team and CEOs, because they are human and vulnerable, and when you're presenting in a way that you're in leadership position, you're quite strong, and people can't see weakness in you, or at least that's the perception. I think people in those positions are most vulnerable, because when you do start to have signs or symptoms of whether it's even clinical depression or anxiety or not, even if it's stress leading to feeling down or anxious, you can burn out pretty quickly and not be aware of it, and others may not be aware of it.
All right. And if we want to expand the conversation just a little bit to how a board can get a handle on what the state of wellness is of their employee base, I want to come back to something that Mary Jo said a little earlier, and that is, in a situation of crisis like this, not to overwhelm management with a lot of additional reporting and work. But there are possibly some simple metrics that can help the board understand what the overall wellness is of their employee base. And Mary Jo, I'd just like to come back to that and get your thoughts on that, on how the board can get, a line of sight onto what's going on.
Clearly metrics are most meaningful if you've been monitoring health and wellness as normal course in your organization through your HR committees. Like, for example, looking at and understanding the trends in your industry, looking at absenteeism and short-term disability, duration of your mental health claims, number of people accessing EAP. In the long run, the programs that we put in place for training for mental health, those are all more long-term and should be normal course in today's running of corporations. I think the metrics that we're going to be most meaningful in the moment will be clearly the numbers of individuals that are directly affected by this pandemic in terms of illness and absenteeism, maybe loss of family members, loss of life. Those are pretty dramatic. But I think the metrics are going to come from less perhaps at this moment in time numerically and more from the insight that we're going to gather by our pulse check with the leadership team, recognizing the individual issues that they're trying to deal with and mitigate. And really importantly, especially for chairs of HR, maintaining a regular communication and update with the chief human resource officer so you understand the unique issues in your particular organization where you can offer wisdom and support. And, and then I'll look back retrospectively on asking staff, how did we do through this? How did we manage through this? Did you feel supported? What can we learn from it? So probably a little bit less perspective on than actual numbers and metrics at this stage of the game, and more how critically important it is to manage and monitor these types of indicators as a normal course of business. Right.
Nigel, I know you'd like metrics. Are there some that would be suitable in this environment, or is this, as Mary Jo would suggest, this has got to be an ongoing part of the culture of the organization?
Yeah, I think it's a bit of both. I mean, certainly from an ongoing perspective, it's tricky because it depends on the coverages provided to employees. So we do want to look at things like incidence and duration of disability. That's an easy one, but often there's segments of the workforce that may not have short-term disability coverage. So I think where there's data available, certainly that's useful. I think some of the questions that we leverage in engagement studies go a long way to giving a pulse check to how your people are feeling. Like, are they feeling their best self? Are they feeling comfortable in the workforce? I think turnover is another metric. So those are sort of more long-term metrics. In terms of today and sort of the short term, I think the number one I would look at is the portion of your workforce that's off work, right? So whether, we've seen volumes through the roof, both from a short-term disability perspective, but also when you look at things like the portion of that's off work due to self-quarantining, for example, for 14 days. So that's a pretty easy metric because it stands to reason that, that the greater portion of your workforce that's not performing or at the top of their game, they're actually putting more productivity pressures on the rest of the workforce in addition to everything else we're all dealing with vis-a-vis anxiety. So that's probably what I would focus on in the short term, and then revisit sort of the business case, business issue around longer term metrics to inform your decisions.
Got it. Great. I want to wrap up with a practical question for all of you, and I'll start with Donna. But the question is as follows: for the people listening to this webinar, what are the tips for all of us on managing and getting through this COVID-19 crisis? Donna?
Yeah, I think some of it was touched on as we were, working through this webinar, but I think self-care is really important. I mean, basic things like eating healthy, exercising, staying active, getting fresh air. Even though we're not allowed to necessarily connect physically with one another in the way that we used to, we can still stay connected to one another in different ways. We can, I think it's important to be informed, and media and social media are really important, but I think balancing that and not being overloaded with media and overloaded with information. So being informed but not over-informed, if that makes sense. I also think for people who are working from home in particular, having a routine is really, really important. Getting up at the same time every morning, whether it's 7 a.m., if you have breakfast as your normal routine, doing that, having a shower and getting dressed as if you were going to work, taking breaks, having lunch breaks, natural breaks during the day as we would hopefully take if we were at the office. And having that routine and structure really does help, along with, of course, getting enough rest. And I think for people who are, who are not, again, don't have clinical mental health issues, again, staying connected is important and not being socially isolated, but people who do have people that they talk to or they see a therapist, a psychologist, continuing to do that, connect. People are doing video sessions now, phone sessions. So continuing to have that ongoing care, I think, is really important, too, to get through this.
Right. Nigel, what are your thoughts on this?
Yeah, I'd say that, firstly, for most of us, this is the first time we're experiencing something like this. So I think staying connected and understanding what others are doing and working through this together will go a long way. Maybe building on Donna's points, I would just say maybe my overarching tip for senior leaders and for boards would be to recognize that employers have a key role to play in stepping up and doing their part to protect employees' health and well-being, including things like ensuring physical distancing is possible to protect their physical health. And I think equally important to recognize and implement the right levels of mental health support to address their mental well-being. So I'd say that I guess my tip would be for organizations to periodically take stock throughout this pandemic to see what they're doing to protect their employees' physical health and well-being as well as their mental health. That's
great. Mary Jo, would you like to add anything to that?
I think those are really the comprehensive points on limiting intake of information to really reliable sources and developing daily routines. I think I'd also just remind us that, for all of us, our employees and ourselves, our natural distressors have been greatly diminished. The things that bring us calm, like going to the gym, going out for dinner, for people attending church, whatever those things are. So under a tremendous time of stress, we've lost many of those comforts, and I think this is where it becomes really critically important for, especially for leaders, to be mindful of the signs that colleagues are just not coping and to offer the support that they need.
Right. So before we sign off, I promise that you'll have the opportunity to provide any final thoughts. And Donna, maybe I'll go to you first. Anything that you'd like to share?
I just think to wrap this up, this is our new normal right now. It is what we're dealing with. Often people I connect with, whether colleagues or friends and others, people who are just really trying to get through this on a day-to-day basis. We just need to support each other. I do think that's all around from a staff employee perspective, a senior management, CEO perspective, board perspective. I think we're all in this together. We're all human. We all really need to understand that, this can be stressful for all of us for different reasons, in different ways. Again, like we mentioned at the beginning, whether it be financial or otherwise. And I think we just really need to work together to ensure that we're supporting each other adequately to get through this.
Nigel, welcome. Some final thoughts?
Yeah, so a couple. Despite the fact that I'm an actuary, I don't actually have a crystal ball. So, but I would hypothesize, I think we should not view what we're going through now as a blip along the roadway. I would hypothesize that it will change how work is done and what we mean by a workplace, that we probably no longer want to have unclear work-from-home policies or remote technology issues. I think even the way we'll interact with colleagues who have a cold or are sick going forward will change. We have learned from previous traumatic events, such as this pandemic, that they have the mental health effects go well beyond the pandemic. They continue to present themselves well after the crisis has passed. So I would say we have an opportunity as organizations to think about what the new normal is and ensure that employees have access to support and that they have the peace of mind knowing that organizations are there to value their well-being and hear their concerns.
Super. Mary Jo, looks like you got the final word.
To Nigel's last point, I think we through the crisis, like any crisis, but in particular the one we're in today, unprecedented for most of us, we've got to find the silver linings. And I think Nigel's absolutely right. This is going to be a new normal in terms of how we think about the future of work. And, if you think about the pace, the accelerated pace of change that every individual and every corporation has gone through to enable people to work from home, to enable uptake of mental health supports through this crisis, these are the things that we're going to build on and that will be critical to the success of our recovery from this, hopefully in short order.
Great. Well, thank you very much to our presenters, and thank you all for listening to this webinar. Look out for new installments of this series every week as we continue to navigate this challenge together.